the next set of fractures, which is called the Greenstick fractures. Again, one has to be very, very careful in how we interpret the site of deformity and the angulation. Otherwise, these fractures can come back and hit us with a stick. So very, very important again to analyze before we treat. So always analyze the fracture and then we plan the treatment. If you see these two fractures, you can see that the apex in this forearm is on the dorsal side, and here it is on the volar side. Both the injuries are Greenstick, but there is a major difference in the direction of the angulation, and this is important to understand because there is what is called the rotation angulation correlation. So whenever there is the volar apex deformity, that means there is a supination injury, and when there is a pronation injury, you have what is called an apex dorsal fracture. So whenever there is pronation injury, the apex dorsal, and again, like I mentioned earlier, the radius is shortened. For any pronation injury, the radius appears a bit shortened. You can see the direction of the injury.